6:44 on your Thursday morning. An employee of Triumph Foods dies of COVID-19. That's the first death in Buchanan County. The meat processing plant in St. Joseph is dealing with an outbreak after more than 400 employees there tested positive. All of them, we're told, were asymptomatic.
One of the most urgent questions researchers are trying to answer is how long the virus hangs in the air and remains infectious.
Yeah, last month, the U.S. Biodefense Lab found the pathogen doesn't survive well in direct sunlight or at certain humidity levels. If the virus can remain airborne, though, it could potentially explain why we've seen such a surge of cases in enclosed businesses like factories and nursing homes where people are close together.
And this morning, we're joined live again with Dr. Dana Hawkinson at the University of Kansas Health System. So, doctor, what can you tell us about the virus surviving indoors versus outdoors?
Yeah, we have just a few studies about that, and again, most of these studies are done in laboratory settings, so perfect conditions. You know, they've looked at different surfaces, especially non-porous or flat, hard surfaces like plastic and granite, but also other metals like copper. You know, we certainly think it can live for hours. There have been reports about days. However, you have to remember that once the virus is out of the body and the saliva or whatever material it is, say if you cough or sneeze, starts to dry up, the virus is going to quickly somewhat quickly degrade. And so the concentrations, even if you can detect it several days out, are probably not going to be real significant. And again, the detection for most of these is based on the genome detection, not really looking at live virus. So for the most part, yeah, it could probably survive on a lot of surfaces for hours, but the virus does start to degrade and break down soon after, like I said, being expelled from a cough or sneeze, things of that nature.
Doctor, I think most of us did not realize there was more than one kind of coronavirus when all this started. We're still learning about that as we move along. There's some new research that's getting a lot of attention right now, saying that a very contagious strain of coronavirus came from Europe and quickly became dominant worldwide. A lot of infectious disease experts like yourself skeptical about this. What's your take on this new research?
Yeah, I mean, it's pretty amazing. Again, I did see an article, but again, it hasn't been peer-reviewed yet. It's an early pre-publication, but it's pretty interesting. Again, all of this, the virology that we're learning about the virus is pretty interesting. We do have to remember that the virus is 30,000 kilobytes. So there's a lot of base pairs in the genome. You know, what does that mean? Well, it's pretty large as far as a virus goes, but we also have to understand that from the samples that they have been able to sequence, really the original virus to the viruses they're finding now are really not different, other than probably about 15 to 20 base pairs. But it only takes one of those base pairs to cause a mutation. I think certainly the reference that you're referring to shows that maybe there was a mutation in the spike protein of the coronavirus, and so therefore maybe it caused it to change and become somewhat more hyper contagious or more contagious than another strain. That could be. I think we still need to see that out and look at where we're at, you know, months from now, and continue to evaluate and get the new viruses and study their genomes to really understand what that means. So it's good preliminary research. We have to take it for what it is and just be aware that we could still do regular simple things to help protect, even if it is hyper contagious. So.
Dr. Hawkinson, before we saw documented community spread here, there was a lot of concern about whether or not hospitals would be overwhelmed. So we want to check in with you this morning. How many confirmed cases do you have at your hospital, and how is that capacity-wise for you?
Yeah, I mean, the surge was always a concern. You know, last week we were, I think, down to 17 patients. We had normally been running about the mid-20s. This past week, for the last couple days, we've been about 28 to 30, with just under half of those in the ICU. So we still expect and prepare for a surge. We want to make sure we have enough PPE, enough rooms and enough ventilators, as well as enough medications and important drugs to keep you sedated and safe that when you are on the ventilator. So we are still preparing for that. we do expect that, especially now if we're going to be opening up and more people are going to be possibly in contact and infected with the virus.
So, doctor, we get the question a lot, if the hospitals aren't overrun right now, do we really have an issue? What would you say to those folks?
Mm-hmm. Yeah, I think just look around the world. And again, I don't want to compare our experience here in the United States to other countries, but look at New York then, you know, our neighbor to the east, and look at Louisiana and Detroit. It happens. Those things happen. Overwhelming of the healthcare system does happen. And even more important, we don't want our first responders, the people that protect us, the police officers, the firefighters, the EMTs, we don't want them to get ill and not be able to do their job. We don't want our supply chain drivers, the truck drivers who deliver our supplies to the and our goods and our foods and to the stores to get sick, because then everything will break down. We've already seen it with the meat processing plants, where some of those plants have had to shut down. I know President Trump made that order, but that has significantly affected our food supply, and you see stories like that every day. So a surge can absolutely continue to happen. Again, as we open up, we continue to have to be vigilant and do the right thing to protect ourselves and other people from getting the illness.
Dr. Hawkinson, thank you as always for joining us. We appreciate it.